Coming up on Mayo Clinic Q&A.
It is a day where we can show appreciation and gratitude to all those who gave up a big portion of their lives to serve us.
Veterans Day is a holiday held on the anniversary of the end of World War I. It's a day to recognize the men and women who have served in the U.S. Armed Forces, to honor them, and to say thank you for their service.
Veterans are really no different than anyone else that didn't serve. We just got some different stories, and they pledged their lives to support our system. So actually just wanting people to be comfortable with what a veteran is.
Welcome everyone to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. Veterans Day is a federal holiday in the United States for honoring military veterans of the United States Armed Forces. The theme for Veterans Day 2022 is honor. And this year, we would like to honor our veterans by showcasing some of our incredible programs and efforts here at Mayo Clinic. With us today are two Mayo Clinic employees who've been heavily involved in various initiatives and programs to support our veterans. Charlie Hall is a security operations supervisor at Mayo Clinic in La Crosse. Charlie served in the Army as an active duty rifleman with a combat tour to the Balkans and as a paratrooper with close to 100 military parachute jumps. Loren Olson is a Mayo Clinic Hospice chaplain who often works with veterans and their families as they reach the end of life. Welcome, both of you, to the program.
Thank you, Helena.
I have to say, Charlie and Loren, that I feel very honored to sit here with you today and be able to talk to you about your experiences and your experiences with veterans. Thank you both for your service.
Thank you very much, and likewise.
Charlie, let's start with you. Thank you for your service to the military. What is one memory that you'd like to share with us about your time in the service?
I guess there's just so many in a 20-year active duty career, that not much different from a lot of careers in the world. Really, it just comes down to one thing for me, really, is just pride in being a citizen of our country and being privileged enough to not only serve for the United States, but also being called into a combat zone. Really has been the pride of my life, really, in my work life, separate from family and children. That has been an overwhelming theme for me. And, otherwise, the two parachute malfunctions I had where I nearly wasn't here anymore, those were significant events also.
Charlie, did you jump again after that? That's the one thing I wanted to ask you about. I am terrified of heights, and I don't know if there's literally anything but someone pushing me out that could make me jump out of an airplane. What was that like?
It's interesting that you bring that up, because I'm also terrified of heights. One of the things that the military does is they train you at 34 feet in a tower. That's where the human brain, in most cases, can detach from the height aspect, and it becomes more of a, like, we're riding around in a jetliner aspect, and we're not so physical with the ground in close proximity. But I was afraid, and in the Army, in the paratrooper world, in the airborne, we have a back on the horse mentality, very similar to on the farm. The horse bucks you off and you got hurt, you're getting right back on it. And so I jumped. Actually, when you have a malfunction, they require you to go through some extra training, and I think I jumped 3 times in one day on an afternoon.
Charlie, tell us about the Final Honor Walk program and why it's important to you.
The Final Honor program is something that I wanted to develop. I thought we could do more in that area, with just being privileged again as much to be able to work with the Mayo Clinic brand and everything that the greatest healthcare organization on the planet brings. I just thought that we could do more in that area. I had worked with, as I think we're going to talk about later, with the We Honor Veterans program in Rochester with hospice, and the near end of life things with veterans, that all the great things they do there. I'd had the privilege of doing that, but I saw being able to do a little bit more in an inpatient setting. And there were some obstacles, as we all know, in a healthcare setting. We have health information obstacles. We have, sometimes it's just really hard to institute a new program. But really, the leadership here in La Crosse and our global security leadership just really made it easy. And we're really on the team to provide a final honor walk, if you will, of veterans when requested. And usually with family supported by our staff as we go through that final walk in the flag draped transport. It's really a special program. It's something that I kind of envisioned, and I wasn't really sure if we were going to be able to pull it off, but with the great leadership that we have here and as easy as they made it, it really is a rewarding program.
It's wonderful. Thank you for sharing that, Charlie. Loren, I'd love to pull you into the conversation and have you tell us about your work and how you help veterans and their families, including the We Honor Veterans program that Charlie just mentioned.
From spiritual care, we, in end-of-life issues, we do want to talk to people about, what are the really important events of your life, or the things you did in your life that were very meaningful, that help shape who you are, that help you look back and say, yeah, my being here made a difference. And for many of our veterans, as Charlie said, there's just really that point of pride, that, for a period of their lives, they did, kind of leave behind their own agendas and go to work for our country, whether it was, for a mission, like in wartime or just, peacetime, serving the country in some way. There was just that feeling that, I'm proud of what I was able to accomplish during that period. So I just, when I'm working with veterans, I always try to bring that into the conversation in terms of how that experience impacted their broader journey in life. And oftentimes, it's very positive. People have very positive experiences in their service. Some of the best friendships they ever made were in their service. I'll be doing a funeral on Wednesday for somebody who, even though he spent his whole life, or his whole military career in cryptology, in small little offices, working, far away from any kind of battlefield or anything. For him, that was just such an important part of his life that he served his country, in the United States Air Force for 4 years, and it was a big point of pride for him that he was going to be able to be buried at the State Veterans Cemetery in Preston. That meant a lot to him. So again, it's that point of pride. There's also those issues that come up because sometimes being in harm's way, things happen. Charlie had the experiences of parachute failures. Even practicing for combat can be dangerous. I had a patient who did not want to talk about his war experiences at all in Korea until he got near the end, and then he talked to me about being a Marine machine gunner and mowing down dozens of enemy troops, and just that question of, is God going to forgive me? Will I be welcomed into heaven after I did that? I mean, it's that kind of experience that thankfully I've never had to experience, but some people, the service of their country, are called into those situations that are unimaginable. Another patient I talked to was in Vietnam, standing on a low footbridge over a creek with his best friend, having a smoke, and suddenly a sniper shot his best friend and killed him. And they were on a break, and and for him it was that issue of why did the sniper choose him instead of me? Why am I alive and he's not? And again, that question really shaped his life. And even at the end, he kind of struggled with that question of, why did I get to live to be 75 years old where my friend only lived to be 19? And those issues come up. So, but for me, it's meaningful to have the opportunity to work with people through those issues in a spiritual way and help them maybe some meaning, find some closure, find some peace.
Just you sharing those stories, Loren, makes me sense how important this work is. My own father died on Mayo Clinic Hospice here in Rochester, and was a veteran and had a veteran's pinning, and that meant very much to him. He didn't remember a lot of things, but he remembered his time in the military and was very proud of it. And he too is in the Preston Military Cemetery, which is a beautiful spot. What important work you're doing. Tell us what else the staff and hospice do to help build trust and with veterans and their families as you're working with them.
Yeah, I think one thing we can do, everybody has their own unique experience, and we all live our own lives, we die our own deaths. But I think it's important for us to be aware of the special concerns that sometimes arise with veterans and their families. Like I just talked about, the PTSD issues that can come up from service, the missing important events because you're deployed, just things like that come up that we can be sensitive to and think about as we're offering our care. So, I think it's just part of our commitment to care for our patients and put the needs of a patient first. And sometimes our veterans have special needs, and because of that, we need to be aware of that. We need to do some training in that. We need to find ways that we can support them in that journey. And one of those is by honoring them, by celebrating their service.
Charlie, can you share with us a memorable moment or achievement that you've had while working with the Honor Walk program?
They're all so special, Helena. As you know, they're all unique. They're all beautiful in their own personal, individual way. But one I do remember is, without getting into any details, we did have a gentleman pass inpatient that actually fought alongside of the United States in the Vietnam War, and was a friendly supporter, both militarily and conceptually, and his entire family was upstairs at the time of passing, and they requested us. And that was just another one of the very unique services that our great security team does on a 24-hour-a-day basis. When called upon. They're all unique. All of the situations are different, but that one really sticks out for me because that was not only what we would, refer to as a veteran that completed the mission. At the time all of that happened, he didn't even live in this country. He wasn't, he wasn't even a legal citizen at the time. And for the amount of things that family paid, it was pretty remarkable to be able to be a part of that and have them open up and have us come in and perform that for them. Definitely one I won't forget.
Loren, you shared a couple, but I'll ask you the same question. Do you have a story that you would like to share or a memorable moment from working with the We Honor Veterans program or other veterans initiatives here at Mayo?
Yeah, I can think of a few, several, pinning ceremonies that were, particularly meaningful. One that comes to mind right away is we have a patient who had struggled with mental illness and addiction much of his life, but did do 4 years of duty in the United States Army, serving in the Philippines and Korea, and we were able to do a veterans pinning for him. And what I saw was kind of a transformation, because we kind of looked at a life where there'd been a lot of disappointment, a lot of difficulty, but we were able to bring him back to a time when he was a capable human being. We did serve 4 years in the Army with distinction. He did a great job, and also there's that pride of country. We were able to remind him of a time when it wasn't all about his problems. At a time that he was serving others, when he was doing useful things, and he just talked about that for weeks and weeks. after that pinning ceremony, because it just meant so much to him to be honored and to bring back those memories of his military service.
Can I ask you one question to describe for those who've not experienced it what a pinning ceremony is?
Sure. Yeah, pinning ceremony. It's just a small, simple way of saying a thank you to a veteran who come into the veteran's home or where they're at, and we usually bring a pillowcase that represents the branch of the service that they served in. A small little pin they can put on a lapel, or a lot of them put them on their military hats. A coin from Mayo, expressing our appreciation for their service, and a certificate. And we just do, it's a short little ceremony, just saying, well, first of all, we invite them to share that you invited Charlie and some special experiences from their time in the military, and then we just do a short ceremony of thanking them for their service, and then again, if they're open to it, we offer a prayer, a blessing for them at the close of the service. So, and it's a ceremony that can take 5 minutes. I was at one last week that took 1 hour and 20 minutes because they got this veteran talking about his experiences. He was just having so much fun and brought us into the fun. So the ceremony went on and on and on, and we all loved it. It was a great time.
Loren, if I could add one thing off of what Loren mentioned, there are some really beautiful moments in those pinning ceremonies. I personally have witnessed a couple of handfuls of them, of family communicating and getting together when they haven't in a very long time.
Wow.
And, some of the conversations needed to happen, and they did. And, it was just a very, just a beautiful, unique experience that's occurring right before your eyes. And you really had no idea that all of this was going to come together like this. But I'm sure Loren, and you've also been through it, Helena, that it's just a beautiful time, and there are so many good things that occur there. So I completely agree, Loren. It's just a beautiful scenario when that all happens.
It's just a beautiful time, and it can be, as I just, a Mayo employee and the veteran, or it could be, I've been, as Charlie says, I've been in a room with 30 people that family members who gathered to celebrate that event with that person.
Yeah. I actually emceed an event in Minnesota. It ended up it was going to be planned as just one veteran and a few family members, and the home set up a microphone, and they invited the entire home into the area. And I think I had over 100 folks. We had every veteran that wanted to be in that ceremony was in that ceremony. They came through, some on wheelchairs. They saluted the veteran, the family, just the entire atmosphere and the way that it was all set up. I did not plan on that, but I ended up being the MC for a group ceremony, which was beautiful. And I'll never forget that one either.
Oh, that is wonderful, Charlie. Thank you for sharing that. Charlie, what does Veterans Day mean to you as a veteran?
That's interesting. A lot of times people don't understand why veterans don't necessarily get too excited about holidays that are made in their behalf. That's not the norm usually in our country, but when we see Memorial Day come along, I know personally for me, knowing I had 3 fellow soldiers that were killed in both the Iraq and the Afghanistan conflict, killed in action. Memorial Day is difficult for me. I completely pretty much dismiss it. And I don't think I think there's a lot of fellow veteran brothers and sisters out there that just want that day to be done. Maybe similar to someone that lost a family member on a holiday.
Right.
And that holiday comes around and it's like, I can't wait until midnight, and that really for me is difficult, but the Veterans Day, now that is for all veterans to celebrate serving. We've unfortunately sometimes, and we may get into this later, but like one of my wishes would be that if people could really distinguish between Memorial Day and Veterans Day and have, and it takes a little bit. You really have to kind of think about it and research it. Memorial Day is for those that gave their life in battle or in training for the country. And Veterans Day is to appreciate all veterans that have served. And there really is a distinction that sometimes, people don't all know. The media gets it confused a little bit sometimes, not by any fault of their own and not by any fault of anyone, but it's the separation of the two, I think, is really important. But Veterans Day has always been great. I always do make my best opportunity to get out to whatever events we can in my hometown, in my local town, with the American Legion and the soldiers foreign war veterans of foreign wars. So it really is a great day. It's a great chance to honor all of those that served.
It's wonderful. Loren, what does Veterans Day mean to you?
I think, as Charlie said, I think it is a day where we can show appreciation and gratitude to all those who gave up a big portion of their lives to serve us. And like I think of my grandfather, who was a World War I veteran, an ambulance driver in France, who just, Veterans Day was a highlight for him. It was a point of pride, and just it was time to celebrate. And and he loved to tell the stories of his year in France. And uncle has served 3 terms three tours of duty in Vietnam, and you want to say we just want to say thank you for we who benefit from their service. And I think it's just great to have a holiday that's just based on gratitude, and you don't have to go out shopping for anybody. You don't have to cook big meals. You just have to say thank you for your service.
I love that. And I try to do that for each and every patient who comes in my office, and I find out that they're a veteran. Often they're wearing a hat, like you said earlier, and I'll thank them for their service because we're so grateful for that.
Yeah.
On Veterans Day, what are some of the ways, Charlie and Loren, that Mayo staff honor our veterans who are with us?
Well, I think, Helena, you just hit on a big one. What I do the same exact thing when I'm in the clinic here, anywhere on campus or any of our clinics in the region. If that veteran is wearing a hat that signifies their veterans status, if you will, that to me is the okay to come up and thank them for their service. And I do that routinely here. It's usually a surprise to the veteran. They're usually extremely grateful. And that probably is the number one thing, is to acknowledge them. So important in our environment to make people feel at ease when care is coming, especially when there's some complex situations with medical care. There's some very sensitive conversations that have to happen. We all know that happens so much easier when we have great rapport with our patients. So really, with the recognition of on the outward part of wearing the hats, but also on the inside, in the exam room, for example. Not that I've ever been there, but I can imagine as a patient in an exam room, to have some of those potential stigmatisms that come along with your veteran service, circling around mental health issues, homelessness issues, and all of the terrible things that happen in all of our society. But within the veteran segment, there is quite a big incidence of that, to kind of make that veteran feel at ease, if you will, and to not be afraid, if that's not too hard of a word, because they sense that, and a lot of times it's not going to be it won't be a productive conversation. So communication through through all of the different techniques that we use to make people feel comfortable, that they're wanted here, they're appreciated, and we thank them. Veterans, that's just one facet of what everyone does in this world. And we thank our patients for everything that they've done good in this world, and to make them feel comfortable and at ease, and to keep that communication going. So that would be the main topic for myself, is what we can do is just to make that veteran feel comfortable, be confident in their presence, and show appreciation.
That's wonderful. It's kind of like what we would want to do for every patient who comes through the door, with a little added thank you for being a veteran. I love that, Charlie. Loren, what are your thoughts? What do Mayo staff do to honor veterans on Veterans Day and on a daily basis?
And my experience with Mayo is just that it's honoring veterans is part of the culture.
Mm-hmm.
At least in my experience of hospice, Mayo. One of the first things I learned as I came to work for the hospice program was, that we honor veterans. Partnership with the Veterans Administration is important to us. We want to honor that. We want to lift it up. We want to spend time honoring our veterans. So I do think we have developed, a corporate culture that just helps us to think of the specific needs of the veterans in ways that we can be thankful. So I just appreciate that in terms of my experience with Mayo.
All right, last question for both of you. This is your opportunity to educate us. What do you wish that more people knew about veterans? We'll start with you, Charlie.
It's really difficult to answer your question, Helena, because it is a bit complicated. Obviously, if we don't have experiences in life that other people have gone through, it's going to be very difficult to ask. You're going to ask the question, well, why don't you consider this, or why do you know what I went through? And really, it goes through all facets of our lives, regardless of what occupation you're in. But specifically to veterans, as I hit on some of the issues, some of the possible stigmatisms of mental health, homelessness, alcoholism, things of that nature, have hit that small percentage of veterans for this country very hard. I heard a statistic at one point, 1% or less than 1% of all Americans will serve their country or honorably serve their country at some point in their life. That's a very small percentage. So when issues do happen within that, our group, there are going to be some things that come along with them. So again, it would come back to making the veteran feel comfortable, and just know that they went out there and they did everything they could to preserve our way of life. And none of them that I've ever met, and I don't believe I ever will require a dime from anyone or want anything said to them, but they feel that appreciation. And that's really the big thing that I would like people to understand is veterans are really no different than anyone else that didn't serve. We just got some different stories, and they pledged their lives to support our system. So really just wanting people to be comfortable with what a veteran is.
Loren, do you have any thoughts on what you wish others knew about veterans whom you have worked with?
I think, again, the point Charlie made from his own personal experience, and Charlie, of course, has done a lot more with veterans than I have, and I appreciate that, Charlie, that the way you support your brothers and sisters in arms. But,
thank you.
I just, I think you say a small percent serve now, and it's a lot of us aren't touched by military life as prior generations, where you had the major wars with big call up of people and stuff. So, but there are some unique experiences that can come from that in terms of the PTSD. We know that veterans have a higher rate of depression, higher rate of suicide than the general public. So just some sensitivity to those issues that, it is we're all the same, but the military experience is a unique experience, and it can create challenges in a person's life. So I think, just some, supporting some of the kind of programs that are developed to help the veterans is helpful, is useful. But that's just what I think is we could do more for our veterans, but at the same time, at least it's a start to say thank you. Thank you for that unique experience, that unique commitment that they make on our behalf.
Agree with that. And thank you, Charlie and Loren, for being here today.
Thank you, Helena, for acknowledging the programs with the We Honor Veterans Hospice and our inpatient final honors program here. Your podcast here is going to bring so much more support to those programs when they desperately need to be acknowledged and need to be constantly. Folks need to hear what's available there for their patients, especially nursing and folks like that. So thank you so much for organizing this, and what a great time of year with Veterans Day coming to have this discussion. So thank you.
I agree. We want to bring more attention to those programs. Thank you too, Loren.
Well, thank you, Helena, and thank you, Charlie.
Thank you, Loren, for everything you're doing.
Our thanks to Mayo Clinic's Charlie Hall and Loren Olson for joining us today to talk with us about taking care of veterans on Veterans Day. If you are a veteran, we thank you. Thank you for your service. Thank you for guaranteeing the safety of each of us. If you're not a veteran, I encourage you today to find a veteran to thank on Veterans Day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.